A typical diet after a sleeve gastrectomy surgery consists of 2 weeks of full liquid diet. It's all liquids, there's a little bit of flavor mixed in there, and that's a tough part of the diet. People are definitely healing from their surgery, so we cannot have solid foods in that stomach, or potentially there can be some problems. After the 2 weeks of full liquids, we will advance them to a soft diet or pureed type diet. So that's taking meats and grinding them up in a food processor or a blender, and then after those 2 weeks, then we're slowly advancing to a typical normal diet from there. And with the sleeve gastrectomy, it works on two ends. It's partially restrictive, meaning that we've removed 80% of the stomach, so a patient cannot eat as much food, and typically they can tolerate about a half a cup of food at a time, which isn't much. So the patient fills up very quickly, and part of this is learning when you're full. And when a patient's full, they need to stop eating, because 1 or 2 extra bites can cause vomiting or just extreme nausea and a feeling of real sickness. So it varies a lot in terms of who can tolerate what types of food, but we certainly stress protein. That's the #1 thing. So the further a patient gets out from their surgery and the more that their diet advances, we really encourage them to choose protein first. It provides their muscles with energy. When they're losing weight rapidly, we want them to lose fat. We don't want them to lose that muscle. And certainly if your body thinks you're starving because you've cut the calories way down, it will break down muscle for energy, and we want it to break down the fat, and that's where the health improvements really come into play here. But in terms of tolerating vegetables and fruits, certainly people can do that. They do have to chew very carefully if they're close to their post-operative, to their surgery date. But as time goes by, I tell patients you can eat anything that you could before, just a lot less of it. High caloric foods certainly can be tolerated after surgery. Of course, we don't recommend that, but if they're in a setting where they need a cookie or they're really craving that, that's fine, as long as they're making good choices at other times during the day. But it certainly will not hurt them to the point where they'll get very sick. Certainly it can mess with their blood sugars a little bit, but in terms of actually hurting their stomach or their sleeve, if they're far enough out from surgery, it shouldn't do that.